Thank you. This now inviting OP259 for the presentation.
Yeah, good evening, everyone. My study it's a cross-sectional study on incidence and medication non-adherence in patients with a psychiatric illness. Myself, Samaksha PV, a research scholar from the Department of Pharmacy Practice, JSS College of Pharmacy, Mysuru. Okay, as we all know that the psychiatry is a major public health issue since decades, and we know that making the patient adherent to medication is a very greatest challenge in the field of a psychiatry. And according to the literature, we have around 40% of the individual who are suffering from the psychiatric disorder are discontinuing their medication within a year, and also 75% among them are discontinuing within 2 years. As we all know that the depot injections has been prescribed for the patients who are not adherent to medication, but still we have a literature search where we can see that the 25% of the patients who are on depot medications are discontinuing without coming for the follow-up. And this medication non-adherence will lead to the relapse, hospitalization, poor mental function, lower quality of life, greater substance use, and it can also lead to increase in the suicidal behavior in the patients who are on antidepressants and all. So we have, in general, we have many studies established reports which we can say that the medication non-adherence has some factors which are associating for medication non-adherence. But coming to the psychiatry, we have a minimal study regarding the factors associated with the non-adherence in patients with a psychiatric illness. So hence we have come up with a study to assess the factors which are associating the non-adherence in the medication among the psychiatric illness. Okay, study design we have adapted is a cross-sectional study, and the study site is it's conducted in the outpatient department of a psychiatry. Inclusion criteria was like patients who are aged 18 years and above, also any gender, patients who are diagnosed to have a psychiatric illness as per the ICD-10 guidelines, and patients who are receiving at least one psychotropic medication at least for a 1 month. And the method which we implemented are patients who are visiting to the psychiatry outpatient department are reviewed by the clinical pharmacist with the patient medication history has been reviewed, and the patient based on the inclusion criteria, patient will be enrolled into the study. After enrollment, the patients are assessed about their medication adherence through by using a scale called a MARS, that is medication adherence rating scale, which is having a 10 questionnaire with the potential answer of a yes and no. The patient who scores above 5 are considered as adherent to medication, and the patients who scored below 5 are considered as a medication non-adherent. Coming to the resultant discussion, as we all know that the psychiatric illness, the symptoms of the psychiatric illness can be showed in the mainly in the adolescent. So in our study, we found it a similar way, like 56% of the total population out of 400 will fall into the age group of 18 to 30 years, and female are more prone to cause a psychiatric illness, whereas we all know that, and the literature also says. And in our study, we have a 53% of the patient with the female, and who are not adherent to medication are 55% of the total population. And coming to the education history, as we can say that the literacy the status of the literacy has been affected the medication non-adherence. We can see our result like a 48% of the patients who are not adherent are literate, and the statistical significance can also show the same thing. Occupation, unemployment, which is not showing a statistical significance, but still we can see 62% of the patients who are unemployed are having this medication non-adherent. Coming to the income status, and income can also be the part of the can also be the reason for the medication non-adherence. Here in our study, we can see 34% of the patients of the total population are not adherent to medication, and 29 of the total population are fall in the income which who are having a less than 3,000. Next, coming to the socio-economic status, when we compared overall, when we take overall population, 28% of the patients will fall in upper socio-economic status, and when it comes to the non-adherent, we can see that the 36% of the total population who is having a lower socio-economic status are not adherent to medication. And almost 64% of the patient total population are residing in the urban region. And coming to the depression, as we know that the depression is a major leading cause uh, currently. And we can see that in our population, almost 55% of the patients are not adherent to the medication. When we assess the reason for the not adherence, we can see that the psychotropic drugs are commonly cause adverse drug reactions. So 46 patients out of 400 has said that due to the adverse drug reaction, they have not taken the medication. That was the reason for not adherent. And following the irregular follow, financial reason, lack of insight on treatment, myths and misconception, non-availability of the drug, a lack of insight on disease, forget to take medication, no improvement on treatment, and also lack of family support. Uh, when a if any patients are suffering from the psychiatric illness, we can see that the educating the patient might not be educating the patient regarding the disease is also important factor. That is one of the reason which the patient, almost 17 patients has been given with the same reason that they don't have any education on their disease. Okay, coming to the factors, we have divided the factors into three factors, like patient related factor, medication related factor, and also the disease related factors. As we can see, there are almost five patient related factors which has caused the reason for not adherence for the medications. One is irregular follow up, financial reason, as I showed you in the demographic slides, that the patients who is having a lower socioeconomic status are more in a non-adherent group. And also like lack of family support, no improvement on treatment, myths and misconception regarding the either maybe regarding the treatment or regarding the disease or regarding approaching the society. Coming to the medication related factor, like as I told you, psychotropics are more common to cause adverse drug reaction. So because of that, like 20% of the total our population of among the 172, 20% of them has stopped the medication intake due to the adverse drug reaction. Coming to the disease related, as we can say, lack of insight on disease is also one of the factor to cause the non-adherence of the medication. Next slide. So as we saw that there are many factors which are contributing for the non-adherent to the medication. So here with the I'm concluding, like strategies are need to be developed and implemented to enhance the adherence of the medication and thereby also the therapeutic outcome in the patient with the psychiatric illness. These are the these are the reference which I quoted in the introduction slide. Thank you.
It's a very good work. Now, in your case, how did you get the consent? Because the patients are psychiatric, how did you get the consent for this study?
Sir, we have asked the patient, before consulting the psychiatrist, the patient medication history was introduced by the clinical pharmacist. We asked the patient and we explained about the study, about our study, and we have taken the written consent forms. Printed on the printed document, we have taken the consent. The patient had agreed, and then the patient was enrolled into the study.
Uh, you did not exhibit the questionnaire. Can you show the questionnaire? Do you have it with you now?
Uh, no, sir, I don't have it with me now.
Okay, because see, what I feel is the role of the attender of the psychiatric patient is very important. So the
Yes, sir.
awareness of the psychiatric patient's attender is a very vital point. You never addressed that issue. So did you take it into consideration?
Yes, sir. Actually, when we assessed, when the patient gave the lack of family support, usually the patient, in the other study, we have considered the accompanying person also. Like, is the patient is coming alone, or is the accompany, is there anyone to accompany them? So, when the patient say they have a lack of family support, actually I wanted to include that also, but this was a separate study. This is like a pilot study, where the other study we are conducting is like what when the patient says that these are the reason for non-adherent, what can we done? If the patient says lack of family support, we will direct them to the clinical psychologist, where the family therapy will be included to educate the patient regarding the severity of the disease and all. If the patient says non-availability of the drug, we can direct the patient to the respective pharmacy where the drugs are available. So that is a different study. This is just a pilot study to know what are the factors. As I told you, there are well established studies in India regarding the clinical practices like diabetes mellitus and hypertension, breast cancer and all. Coming to the psychiatry, there are very minimal studies regarding the factors associated with medication adherence. So we have just taken this study, sir.
What was your N value? How many patients did you take for the study?
Sir, totally we assessed for 400 patients, sir, newly diagnosed patients who had taken the medication for 1 month. And out of 400, 172 out of 400, almost all the patients agreed to participate in the study. Among them, 172 were not adherent to medication within the period of 1 month.
What are all the statistical tools you have used?
Sir, statistic descriptive analysis was done, and also we have chi-square test has been applied for the medication non-adherence and medication adherence with respect to the variables, as I told you, with the literacy, income status, and socioeconomic status. In that, we have found that age literacy is also statistical significant for the medication non-adherent, and also the income.
Very good work. Over to my colleagues.
Thank you, sir.
Yeah. Samaksha, it was
Yes, sir.
good. Only one question from my side.
Yes, sir. Yes, sir.
You mentioned that ADR is one of the important reasons for non-adherence,
Yes,
right?
sir. Yes, sir.
So, how these people understand about this ADR, where they report this ADR, how this ADR was documented,
Okay.
and what were these ADRs?
Okay, sir, I understood your question. Thank you. Sir, we have a joint initiative in the Department of Psychiatry from the clinical pharmacy, and the Department of Psychiatry has initiated a joint collaboration where the clinical pharmacist will be there from 9 o'clock to 4 o'clock. I mean, all in the OPD timings, and assess the patient. If the patient say regarding the ADR, he is not adherent to medication, we will educate the patient regarding the medication. Like it will take minimal 2 to 3 weeks to the body to adjust. In their understanding, we will educate the patient regarding the medication. If the ADRs are very minimal, like dry mouth, increased sleep, or like and also like if the patient feels like very thirsty and all, we will say the patient to take the fruits or a vegetable which is having a water content like cucumber and all. So we will educate them. So the all the ADRs which has been presented from the patients are reported in our department based on the Naranjo scale and WHO scale, sir. The assessment tools has been recorded, and we will submit to the department, and from the department it will go to the Uppsala Monitoring Center database.
Okay, thank you. Thank you so
Thank you,
much.
sir.
Samiksha,
Yes, sir.
yeah. How long you carried out this work?
Hello, sir.
How long you carried out this work?
Sir, this conducted for 11 months, sir. 11 months, sir.
11 months.
Yes, sir.
So I think all the 11 months
Document
means I think you
with you.
Yes, sir.
Okay. Any videographic?
videographical evidences for the any
No, sir. No videographical evidence.
Mhm.
Yes, sir. And this is my research topic. This is one of the objective in my research topic. So along with that, everything else. So no videographing is there, sir.
Why? Because so you deal with almost
11 months
and
400
and
I think
the quantity of the volunteers is
almost 400, right? How much?
Yes, sir. 400, sir.
400. So it is a very big task,
no?
Yes, sir. It's very
What is
challenging.
your experience?
There is quite long experience. Sometimes very bad experience, and sometimes the patient, the services which we provided that has been appreciated sometimes, and sometimes the psychiatric patients, like they do, because of the mood swings, there are very bad experience also, sir. But most of the time there are good experience. And also we are collaborating with psychiatrists, and so that is very helpful for us.
Okay. What about for the physicians cooperation?
Yes, sir.
What about physician cooperation?
Psychiatrist cooperation.
Yeah, yeah.
Yes, sir. As I told you, like we have a collaboration with the psychiatry department. We have one more chamber there, along with the clinical psychologist, the pharmacist also having the JSS minds. Like medication information for neuropsychiatric sensitization information. So we have, and we will stay till the OPD timings also, sir. From 9 to 4, we will be available to answer all the drug information and to answer all the queries from the psychiatry department. This is a first initiative has been done in India, sir, as per my knowledge.
Okay.
So it's
So
a joint work, sir.
what is the benefit of the psychiatrics from these studies? I'm talking
Sir, it's
about the physician aspects.
sir, one thing is it's very easy to convince the patient to come for the follow up, and the follow up they can't miss it, sir, because we are reminding the patient to come for the follow up. And also knowing the patient regularly, even psychiatrists will also can know, like what is the frequency of the improvement. Every month they are visiting, so that's how it is benefitable, sir. They can
Okay,
know
fine.
the severity of the disease, sir, if the patient is regular.
Okay, so you make it all the documents whenever
Yes, sir,
you
we
are going
will
to
make.
present the paper, no?
Yes, sir, we have all the documentation, and we have presented the paper also, sir.
No. Now you are presenting. So whenever presenting, you need supporting documents so that it is helpful for that. That too, you have to deal with the psychiatric for that almost 1 year of time.
Yes, sir.
That's what we very eager to see the some of the uh, your studies. That's why.
Okay. Okay, sir. I would have brought it.
Yeah, in future at least.
Yes, sir. Sure, sir.
Thank you.
Thank you, sir.
Thank you.
Thank you.
Thank you so much. This was poster number OP259.